Good morning, good afternoon, good evening from wherever you're watching us across the globe. Also depending on what time you get to watch this video. It's another Monday. I am so blessed and glad to be here. To the new gang that have just joined us, thank you so much. But I'd like to know where you're watching us from. So please, on the comment section, niambie to notification gang manze nyindo wale wase. I celebrate you, I love you, and I do this for everyone that comes to this page to basically get whatever they get to get from us, because that's why we do it. Sindio? And if you've not joined, misiju unangoja nini? Kama ni firimbi nikupigie, please subscribe to this channel, because it is definitely a channel you need to subscribe to. Saweni. And today, wow, our guest clinician is back, because Ruby is still not feeling well, so wacha tumombe afueni njema arudi aje awe nasi. But before that, let me introduce Salome Ndeto in the building.
Thank you very much.
Yes.
I'm happy to be back again. My name is Salome Ndeto, a cardiac clinician.
So imekuaje since the last time you were here?
So far so good.
Yeah.
A lot of trainings, but salama. Yeah.
How's the COVID situation?
Tunapambana.
On the ground?
Yes, it's here to stay, so we have to take care of ourselves.
Yes. Thank you so much for coming. Now, our guest today, I will let her introduce herself, but she's a very beautiful woman with a beautiful, extraordinary story. Let's welcome Sandy.
Hi guys. Hi Nana.
Hi.
My name is Sandy. Okay. My full names are Sandra Wanjiru Ngure. I'm 29 years old. 28, turning 29 years old.
Okay.
Yeah, I'm happy to be here. I'm an entrepreneur and I'm also a fashion stylist.
Yes.
Yeah.
Jiplug wapi hapo?
Jiplug kwa Instagram, Sandy Shiro. Facebook, Sandy Shiro. Yeah.
Yeah, go guys, go check her out. Now, the reason we are having this conversation with Sandy today is because so many pregnancies, once you decide to have, to get pregnant, you never know what lies ahead. But sometimes it could be an ectopic pregnancy, and that's why we have Sandy to tell us her story. So Sandy, kindly take the floor.
Thank you very much once more. This story I've never shared with anyone. I don't think even my friends know, because it's not something you talk about it every day.
Yeah.
It's not an easy thing to talk about it. It happened last year, March, on date 3rd.
Yeah.
It was quite a journey. My journey begins. It's quite interesting, and again, it's sad a bit because it started on January, where I was in the coast. From Nairobi to coast, there's climate change.
Yeah.
So when I went to coast, my periods didn't come.
Okay.
So I told my hubby to be that, nikunoma, as in, I'm not getting my periods.
Yeah.
He was like, kuna kamtu hapo ndani. I'm like, no, climate change. Then I was in denial because I was like, haiwezi kuwa.
Yeah.
I can't get pregnant. Eventually, he told me, insisted that you need to go get tested. Me mwenyewe sijui pregnancy kit, how people use it and stuff. So I was innocent. I went to the chemist and asked, how much is it? I went back home. We did a video call because I was in Mombasa. He was in Nairobi. And then I saw your test ilikuwa, one was blur.
Yeah.
Yani, so many knew it's negative.
Yeah.
I was so happy. I was like, hey, Fuchs, at least.
You were not ready?
I wasn't ready, honestly.
Okay.
But I was like, hey, at least. I told him, hey, babe, Fuchs. He's like, no. Something told him, and Gakan, go do a urine test and also a blood test. Okay. So I went, and then nikashikwa na butwa.
Yeah.
I was told, congratulations, you're going to have a baby. I was so shocked because unashanga utaambia watu nini? How will you tell? Utaambia your parents. I'm the only child in our family, so I will tell what my parents, my friends, society, my social friends, workmates, everyone. But he was like, you know what, we have to do this. I'm proud of you. He had my back.
Yeah.
He held my hand. He was like, ataka uko Mombasa, I will come see you. So he came. He boarded an SGR and came.
Yeah.
So when he came, He told me congratulations. We had our moments, crying moments, and happy moments too. Then I went to Nairobi. I came back to Nairobi. So tukaamua we go to our first clinic. So we went to Dr. Tho. I think he's known by people. He's a celebrity doctor.
Yeah.
So I was like rigid a bit because I was like nilikuwa najua huyu ni celeb hata ni treat venye au wengine wana treat wangwa. But funny thing, he was a very good doctor and I recommend any person to him.
Yeah.
So when we did the test and scan, he saw I have fibroids. And the pregnancy was there.
Yeah.
But haikuwa inaonekana kabisa. So we were wondering mbona haionekani, but it's there. When we do all the tests, it's there. So we went back home and then I went back to Mombasa.
Yeah.
So we knew we have to prepare for insurance, everything. My guy was bumper to bumper, NHIF, everything.
Yeah.
I was also sorted. But apart, even my parents didn't know anything except me and him. So when I went back to Coast, I was hizo cravings, nakula, started adding weight. I was happy, but again I was nashanga ndambia watu nini. Yeah, I'm scared. How does it go? I'm not prepared. But he held my hand. He was my best friend. He's still my best friend.
Yeah.
Eventually, I came for some leave days. So this was the most terrifying moment of my life.
Yeah.
It wasn't easy. I remember I came. We weren't in good terms, but mi ni wale watu ka tumekosana ndakutafuta tuongee.
Yeah.
So I went and looked for him. We ate lunch / supper. That was my last supper. I believe that was my last supper. That was March 2nd, 2020. That was my last supper. And lunch. Hiyo siku nilikula sana. Yani, I think God was trying to show me by the way there's something ahead, because nilikuwa tu na visualize nasikia uchungu, but namwambia nasikia pains, abdominal pains. But I used to take it's called medicine, but it has a low percentage of it's called what? It has a low percentage of like mg. It's the lowest when you are pregnant.
Yeah.
So when I went home,
were they prescription drugs?
Yeah, prescription, yeah.
Okay.
So that was my first time to have those pains. So when I went home, he's at his house, me I'm at my parents' house.
Yeah.
So that night was the most horrifying night of my life, because I woke up at around 6. When I woke up at around 6, I wasn't able even to get out of bed. I felt the worst pain. So hata kushuka stairs was hard, even kitanda was hard. So I called my mom. Hakuwa anachukua simu. I walked to their room, knocked. My mom was like, well, so you know how mothers are, umekuja kuomba mafuta asubuhi mapema, cause I'm in Coast. I don't carry my things to Nairobi, so tunashare.
Okay, yeah.
Mother daughter,
Yes.
those things like we ngoja kwanza njitayarishe, tutaongea ndakupitia, ndakupitia.
Yeah.
I'm like, open the door. Yani I'm crawling, open the door. He's like, akaniambia we ndakupitia. I went back to my room. I called my dad, nikamwambia dad, dad sisikii poa. He's like, aje, tebu ambia mama fungue bedroom. So I think when my mom went to the bedroom to shower, she discerned kuna kitu mbaya na
mtoi wangu.
Akiwa holiday Nairobi amkangi mapema.
Yeah.
So she came to my bedroom. When she came to my bedroom, I started puking blood.
What?
Niliona sasa hapo, and it's thick blood, not ile, yani badala upuke chakula unapuke damu. So I knew this is the end of me. Started crying. I called my boyfriend. I'm like, naumwa. Once I texted because I didn't want to call him that early.
Yeah.
So I told him, when you wake up, kindly call me. It's an emergency. So when he called me, he's like, uko, nikamwambia tupatane Mpisha hospital.
Yeah.
So we called Dr. Thuo. Dr. Thuo wasn't available at that time. So I went to Mpisha. I was rushed to Mpisha juu hata bumps za Nairobi. Yani I used to count, nilikuwa na count bumps zote za Nairobi because of the pain. Because sijaisikia uchungu kama hiyo. It was so painful, and me, the worst thing I thought was loss. Sikuwa nafikiria it's anything kitu serious sana. Nilikuwa najua labda I'm going to be given an injection of pain naishe nirudi home. So I went Mpisha. Hata kutoka kwa gari was hard. I had to be given a wheelchair. My mom escorted me to the casualty. Nikalala, nikaambiwa lazima niende scan. That time my mom didn't know even it's pregnancy. Hapo ndio alishikwa na butwa. Aje, mbona ukuniambia? Ungeniambia ningekuja Mombasa. Nikukalishe. You know, all those thoughts. It was a shock to them. So when I went to the scan, nikaona wanaangaliana. So nikaambiwa lazima nirudi casualty. When I went back to the casualty, the doctor who received us was like, you have an ectopic pregnancy.
Did you know what that meant?
No, I didn't know. So my mom was like, ni loss. I knew kidogo, but sikujua it has that effect. As in, sikujua kabisa the meaning of that. So my boyfriend came, akasikia ni ectopic. He broke down. No, that was the most, seeing a man breaking down before your parents was the most, it was most, cause uju mbembeleze, umwambie, I was like,
it's heartbreaking.
Yeah, I told him, babe, pole, ni sawa, it is well, God yuko, ni sawa. So I was like, the doctor who received us was like, do you have a gynecologist? I'm like, yes, Dr. Thuo, but my mind is like, hey, before ashike simu, as in that celebrity doctor, you're like, atashika.
Busy,
But imagine, by the grace of God, alichukua simu, na aka respond, and he came to Mpisha within 30 minutes.
Wow.
Because I was like, nilikuwa nimeambiwa, niko na few hours to survive.
What?
Because it had ruptured and I was bleeding kwa tumbo.
Internally.
So I had to be rushed to the theater within those few hours. Or less, najua ikiclot, it goes up. So we went to the theater. I stayed longer because I had fibroids and ectopic. So I stayed.
Did you know you had fibroids?
Yeah, fibroids I knew, but I didn't know about ectopic. So the doctor was like, when I saw Dr. Thuo, I was like, I remember you. But remember, I met him only once. So nilikuwa napiga hesabu ameona patients wangapi. But he had alikuwa na utu as a patient, and he was like, you know, you're like my small sister. Hapa, I will take care of you till you're okay. When I saw him at the theater, mtu anaonanga two lights. He told me all will be well. So I stayed in the theater for I think 1 or 2 hours. Nikaamka. So the first thing I asked is, will I expect again? Juu labda imeguza all tubes.
Fallopian tube.
So I was like, my questions were many. So after that, hata sikukaa, I woke up unconscious as usual after theater. I was admitted at Mpisha. Then my boyfriend and my parents were there, my friends, people were around me. Eventually, after that, I experienced something of the gastric intestines nashikana kidogo. So I used to
Salome anaweza jua.
Adhesions.
It's called what?
Adhesions.
Okay.
So I puked for 2 good weeks. So that nilikula.
Damu bado ama sasa una puke tu.
Una puke bile, and you know bile is inachoma. Inachoma. Hadi unasikia, it reached a point I asked God, basi mbona umeniweka kwa hii dunia, kaa hii ndi uchungu. Mtu anasikia, umeingia theater, unasikia uchungu. Umetoka, unasikia uchungu. Ndiyo pia, another, that kushikana intestines, I can't eat. That time, my blood levels have gone down. I need donation from people.
Oh my God.
It was because ukienda theater, you lose a lot of blood. So they thought, after nitoke theater, nita-recover juu ya fruits, vegetables nini, but ikanilipukia. So my parents and my hubby to be walikuwa na peana shifts. Moja anaingia asubuhi, mwingine anaingia after. So but all in all, I can say that it was the hand of God, because ilinipata Nairobi. Ingenipata Mombasa where I was all alone.
Yeah.
It could have been worse. Ingekuwa tu mbaya. But one thing I usually appreciate my parents and Dr. Thuo and my hubby to be is that they stood by me through thick and thin.
Support system.
Kupata Charlie anakushikilia despite the good and bad times. Juu many men who lost, who potea.
Yeah.
Wanaingianga, wana lost kabisa. But him he was like, niaje sina do but nda lipa bill.
Yeah.
You know, it's like sina do but ndatafuta venye nda kulipia bill.
Yeah.
Hey, that was a big blow and a big, yani God alinionyesha, you know, through thick and thin, this guy will never leave you.
Yeah.
He's one guy I will live and I will forever celebrate in my whole life. Jutu ya hiyo kitu ndogo, the sacrifice.
Act of kindness.
Act of kindness, act of love. Mtu anakushikilia ukiwa you've messed up cause umejichafua, nini anakubadilisha. Not all men atakushika hosia kuoshe kama mtoto mdogo. See, this guy is called, let me call him PK.
Yeah.
Yeah, I thank you and I will forever celebrate him.
Yeah.
Even Father's Day nilimwambia happy Father's Day.
Yeah.
He's still a father cause at least he brought someone into this world that alienda.
Yeah.
And to all fathers and upcoming fathers, and usiwachilia demu yako akiwa kwa shida kama hiyo.
Yeah.
Cause God gives and God takes.
Yeah.
We are not promised tomorrow, and whenever you put God the constant factor in your life, hakuna siku atai kuacha.
That's true.
Na kuna kitu moja miwambiwa na my dad, he's like, you know what, celebrate someone's strengths, not usipraise weaknesses zake. Celebrate your partner's strengths, juu hujui kesho.
That's true.
Usiangalie ubaya, huyu mtu anakutesa, angalia, celebrate people's strengths.
At least PK bring hope to the boy child, akina Brian, akina Kevo, akina Brayo hapa, kumbe kuna watu wazuri. But let's just dive into the scientific way of doing things and just let people know what ectopic pregnancy is, what are the symptoms, what are the signs, can it be prevented? Salome, take the floor tafadhali.
So, ectopic pregnancy, basically, it's a pregnancy that has implanted itself outside the uterus.
Yes.
So normally, when an ovum has been fertilized, it tends to implant itself in the uterus. So when it doesn't implant itself on the uterus, we call that ectopic pregnancy. The commonest type of ectopic pregnancies is the fallopian tubes. I think that is what people are more aware of it. It's very common to an extent of about 2%. Every pregnant women, 2%. They tend to get an ectopic pregnancy. So basically, of course, we have got the signs and symptoms. Someone will have missed their menses, meaning they've done a pregnancy test, it's positive. So after it's positive, by the 4th week, they tend to have severe abdominal pains. I think she described that. And of course, if they do a pregnancy test, it's going to be positive. And in some extent, when it ruptures, we tend to have some vaginal bleeding. So a pregnant mother will walk in with a lot of abdominal pains, some even vomit, and then the bleeding. Of course, that's it's actually an emergency. So we tend to take that serious. The first thing we normally do, of course, we have to do a scan. The reason why we are doing a scan, it is the only definitive way of making that diagnosis. Yes. We want to be able to be certain that this is not just a miscarriage, but it is an ectopic pregnancy, because ectopics tend to be very severe, and at the same time, they can even result to us losing that mother, that pregnant lady. So once we confirm, of course, it has to be removed because that baby cannot grow. Yeah. Okay, during that time we call them fetus. So definitely that pregnancy cannot grow to more than those 5 to 6 weeks. So definitely we have to remove it. So we have got some high risk factors. Yeah. Of course, if someone has had an ectopic pregnancy, chances of them getting a second one are very high. And then if someone has got fibroids, endometriosis, definitely it is going to put them at a high risk of them getting an ectopic pregnancy. Other risk factors is when someone is having infections. We call them pelvic inflammatory diseases. Also, you're going to be prone to getting ectopic pregnancy. And also if someone has had any gynecological surgeries, again, it is going to put them at that higher risk. So just like what she explained, she had all the symptoms, and of course she had already started the clinics, and that's why we always encourage women, once you discover you're pregnant, start your clinics as soon as possible, because during the first visit we are able to do pelvic scan, and you see, like for her, she discovered that she had some fibroids. So definitely I know even Dr. Thor put her at a high risk, because fibroids, they tend to grow with hormonal changes, and also remember now these are pregnancy, and we expect that fetus it's going to grow for the next 9 months. So once you start your clinics, it's easy for us to be able to discover these things, and then we do what is expected. The one thing I'm happy with her is that she was able to go to the hospital immediately, because ectopic pregnancies tends to rupture. And that rupturing, basically, it's an internal bleeding. Of course, she talked about her having low blood levels, that is anemia. That is one of the complications of having an ectopic pregnancy. Of course, some other can get sepsis. Sepsis is basically high infections, and that's why we always say it's good when you come to the hospital immediately. So once it has been confirmed, of course, we have to go to theatre to evacuate it, so that we are able to clean it up completely, so that you're not able to have other further complications like tubal blockage. So it's easier when it's done in theatre, so that it is cleared completely.
But what about those that cut off the fallopian tube?
Yes, if, like, let's say it had already ruptured, definitely what does that tell us? It tells us that that fallopian tube, it's messed up. So we need to cut it up. But the beauty with it is that we have two fallopian tubes, both on your right and on your left. So that does not necessarily mean that you are not going to conceive again.
But it will reduce your chances to 50% only, 50%, since it's just one.
Yes. But I've seen many women who only have one fallopian tube getting pregnant. The idea is you get diagnosed very fast, and we act on it very fast, and we manage you accordingly.
So not all are cut off?
Not all are cut off. Not all are cut off. And also, if you are able to be managed the right way, definitely the other one is going to be saved. So we are not going to say that you might not conceive. But of course, your chances are going to be a bit low.
So when you have both fallopian tubes and one tube has been maybe like umepulipata mtoi and then ikaoshwa, right? Is it still functional?
Yes and no. Because definitely if it was cut, it is not going to be functional. But if it was just cleared the ectopic pregnancy, then definitely it's going to be functional. But we tend to have secondary tubal blockage.
Okay.
Yes.
After that.
Yes.
And in her case, she said she had fibroids, and then she also had the ectopic pregnancy. Usually, what is the process? Which one do you take first? Why it that she went to clinic mapema and it was discovered? But yes, it was discovered, but bado fibroidiko. So what do you do with it? Utatoa fibroid kwanza, ndio utoe ectopic pregnancy, or what happens?
Of course, she had the fibroids even before becoming pregnant. That's obviously from that. What normally happens is that if someone is pregnant, fibroids tends to grow, right? And also now then she had an ectopic pregnancy. Ectopic pregnancies don't grow past 6 weeks. They don't. So what normally happens, the symptoms come up, and obviously we need to evacuate that pregnancy. So like for her, she said it was about 4 weeks, right? So definitely that pregnancy needed to be evacuated. But of course, I'm happy. I don't know whether they removed the fibroids, but chances are maybe they removed them.
There's so many misconceptions of ectopic pregnancies, but also there are myths, and there are real things that make causes that make people at least advance why like kukuwa na hiyo position wako na at a higher risk of getting it. And I had one story about the e-pills, the emergency pills that are not supposed to be taken. Kwanza, how many emergency pills are you allowed to take per year? And truly, do they cause ectopic pregnancies?
So when it comes to emergency pills, number one, we said, just like what we said the other day, they are not a form of family planning. An emergency pill basically means is that you weren't sure about your days, you've had unprotected sex, and you don't want to conceive. So definitely you can take an e-pill. What is recommended is that you need to take only one in a year. Yeah, but unfortunately in our setup it tends to be like an everyday thing. So with continuous using of e-pills like every month or every week, it is going to put you at a high risk of getting an ectopic pregnancy. Because remember, how do e-pills work? They tend to interrupt the hormonal balance. So you tend to have an imbalance. Then once you have that, if an ovum, because an ovary normally releases an ovum every month, so if that ovum is fertilized outside the uterus, definitely that's an ectopic pregnancy.
Wow. Yes. Sandy, what are some of the, things that you're scared about when it comes to contracting another pregnancy? Not contracting, but you know what I mean.
Yeah.
Moving forward, of course.
Moving forward, definitely my wish is to have a successful pregnancy when it comes. Number two, to continue having that supportive system once more. Number three, I'll be cautious on, well, I won't assume when I just hear a hormonal imbalance like this, I go to the hospital. And one thing I can say is ectopic pregnancy it comes with the withdrawal symptoms after ectopic is you tend to be bitter. Men deal with issues differently, unlike ladies. Because when I was in hospital, it didn't hit me. I've lost a loved one or an infant. But after hospital, ndio ilinigonga serious. I started being bitter. My better half alikuwa amedeal nayo. So we were two different people, because alikuwa anashangaa mbona una jam. You tend to be bitter. Kitu ndogo hivi unakasirika and you wonder mbona nakasirika. Hadi wewe mwenyewe unajiuliza hii kitu ndogo, like putting a glass of water here and kuambiwa tu usongeshe, you get rational. So when you after that I almost went to seek a counselor, because sikuwa naelewa why nakasirika.
So how did you deal with it?
I prayed. First of all, I prayed about it. I opened up to like my mom. It reached a point I told him, by the way, sikutaka kwangu na reactive, because it created a lot of tension between us. Hadi nafika mahali you feel like pia huyu anaweza enda, because you feel like he understand the position I'm feel. Hajui venye na feel. Loss is loss, despite mtu mkubwa mdogo, bora loss ni loss. So to him, he had healed. Me till to date, I have those moments of, by the side ningekuwa na mtoto mkubwa, it hits you, but with time he understood. And when you have an understanding partner, mwambie tu ukweli. Mwambie tu enyewe hapa siko sawa. You accept. First you accept, yes, it happened. Number two, I need you to hold my hand in this journey. Number three, pray about it. Because God hutuweka kwa position fulani. Even in the Bible it says, put God first. And also in good times
and in bad times.
In bad times, just pray. Put prayer a constant factor in your life.
But what do people need to know about ectopic pregnancies that they have not known? Probably you're in a better position to actually tell them.
Okay, so number one, having an ectopic pregnancy, it's not your fault. Yeah, that's one thing I tend to find in most of mothers who have had an ectopic pregnancy. So it's always good, because any loss, it's a loss, and you might tend to, you know, blame yourself and all that. So ectopic pregnancy, that's not your fault. Number two, it's always good as women, once in a while, let's have our body checkup. Let's be able to discover whether we have fibroids, or we have endometriosis, or we have something called like cysts. Number three, any vaginal infections. It's always good when they are treated promptly. You know, let's not agree to this thing of having infections every now and then, and someone is comfortable with that, because again, that's one of the things that can make us have ectopic pregnancies. Number three, we have said e-pills, they are not form of family planning, because they are going to predispose you to getting ectopic. So let's have a proper way of planning when to get pregnant and when not to. Then apart from that, we always say any abdominal pains, any vaginal bleeding in a pregnant mother, irrespective of whatever gestation that pregnancy is, it is an emergency. It is an emergency, and the first thing, once you discover that, you just need to go to the hospital immediately, so that we are able to know what exactly is happening to you. So apart from that, I think once someone has had an ectopic and it has been managed, it's always good to seek counseling, because just like the way we normally have postpartum depression, they also tend to have some form of depression. So it's always good when you talk it out, talk to your spouse, to your parents, whoever, your best friend, but at the same time, it's good not to feel guilty or feel bad about it, because at the end of the day, it's not your fault. And least but not the last thing is that at the end of the day, you have another fallopian tube. You can always get pregnant. It's only that we are saying the chances might be reduced. But apart from that, I think with the right management, with the right treatment, definitely it's going to be sorted out in the best way possible.
Thank you for that. But my curiosity is this: does ectopic pregnancy and the normal pregnancy, like, do they behave the same, similar? Like, do you have cravings both for them? What's the difference?
Yes, they do behave the same in terms of the cravings. Of course, you're pregnant. It's only that the difference is that this fertilized ovum has not implanted in the uterus. And by the fourth week, the fifth, the sixth week, you'll always have these abdominal pains. Yeah, so someone will tell you, I'm having pains. It could be on the right side or even on the left side. And they might even start bleeding or even spotting. So that's why, again, I'm going just to insist, any abdominal pains, vaginal spotting or bleeding, definitely in a pregnant mother, that's an emergency.
When I was pregnant with my kids, I always felt like, even the first few weeks, I was cramping. But it ended just up, okay. Now, is it something to worry about when you're cramping? Because I could feel cramps like I was expecting my menses. But of course, it wasn't, since I was pregnant. Is it something that any pregnant mother can be worried about?
Yes, pregnant mother needs to be worried about, because remember, we have got different pain thresholds. And at the same time, you're not sure of what is happening to you. Now, when it comes to ectopic, the intensity of pain tends to increase with time.
Okay.
So the way I was feeling yesterday is not the way I'm feeling today, or even the way I'll feel tomorrow.
Yeah.
And then it tends to be sided. It could be on your right side or even on your left side. So the best thing to go about it, just go to the hospital.
Hapo sasa. Thank you so much for all this knowledge. And Sandy, thank you for being vulnerable and sharing your story with the world, even before you talk to your friends. But I'm sure they'll find out.
Yeah.
Thank you for being so strong and sharing that story. Truly, truly, you're helping a generation out there. And thank you so much for watching us, guys. Sadly, that's all that we had for you today. But of course, you know, on Monday, next Monday, tutawaletea vitu murwa kabisa. So all you have to do is kindly like, share, comment. And if you have any product that resonates with what we do, and as long as it's of quality, please comment section or send us an email at kakamanagement@live.com and we will respond to you. Also, if there is a topic that you feel like we need to tackle because we're kwako ni pressing matter, please comment down below, share this, comment, like, and see you. Bye.